Hi friends, I am Dr. Vikrant Vijan, DM Interventional Cardiologist from Vijan Hospital and Research Center, Nasik. The first question that was asked to me was what is PAH and what are the causes of PAH? So basically PAH stands for pulmonary arterial hypertension. Basically it is a condition that affects both the lungs as well as the heart. So this is a progressive disorder and there are many causes of pulmonary arterial hypertension. So to sum it up, the first thing that I would like to tell is that there is an entity that is known as idiopathic. That means the cause is not known and it is more common in females and it is a very progressive disorder. You need to treat this condition, identify it at the earliest. At the same time, PAH can happen due to other causes as well, secondary to heart problems like heart failure, or if there are some congenital heart diseases like there is a hole in the heart and that goes undiagnosed and over a period of time the people can develop PAH. Secondary to lung disorder, and there are other categories like autoimmune disorders, scleroderma, rheumatoid arthritis. So because of connective tissue disorders also you can get this progressive disease, and there are various other groups as well. So as we can see in the diagram over here, so basically we have got the left system, the right system. The left side of the heart deals with the oxygenated blood and the right system deals with the deoxygenated blood. But one thing that we should know is that the right side of the heart is smaller in size and the left side is usually bigger. But in PH, what happens due to certain reasons, like imagine if there is a shunt, if there is a hole between the left chambers, the left and the right chamber on the upper side, there can be shunting of blood from the left to the right side, and this can cause pressure overload changes over a period of time. So due to various reasons, if your right heart keeps on enlarging in size over a period of time, your pulmonary arterial pressures can go high. So there are other conditions like pulmonary thromboembolism. So you see a person who is just 20-25 years of age and they present with lower limb pain and sudden onset breathlessness. So there is a condition in which sometimes a clot from the vein of the leg can go into the right side of the heart. So if we talk about the right side of the heart, there is a right atrium, that is a chamber above, there is a chamber below, that is right ventricle, and beyond that we have got the pulmonary artery. So if the clot travels from the right atrium to the right ventricle then to the pulmonary artery supplies blood to the lungs. And if the blood supply suddenly gets stopped, the back pressure changes happen and the right ventricle enlarges in size, that is normally smaller in size, and then the right atrium. And because of this, the patient can present with breathlessness that is sudden in onset and many other symptoms. So there are many causes. Correct identification and treatment is very necessary in this condition. So there can be many signs and symptoms of pulmonary arterial hypertension. The common signs that are clinically seen is that the patient would say that I'm feeling breathless, your respiratory rate increases, you feel breathless even on slight walk, or you can get breathless over a period of time, that is progressive breathlessness. So one of the most common symptom of PH is breathlessness. Initially the patients might not really have so much breathlessness and this can be progressive, but in conditions like sudden pulmonary embolism, like I told that there can be a clot that gets dislodged from the leg vein into the heart, this can cause sudden onset breathlessness which is very severe. So but in PH usually the breathlessness is progressive. So initially they would get breathless or tired on walking a small distance, and this progresses over a period of time. The other symptoms are fatigue. You get tired even on walking a small distance, you have excessive tiredness. As the disease progresses, you can get condition that is known as syncope. So you feel lightheadedness, you feel that you might fall down, but you don't fall, or you can even have a fall because the right heart pressures are very high. And over a period of time, when the disease progresses, you can also have symptoms, the signs like there can be swelling in the lower limbs and sometimes even enlarged liver. So there are these various signs and symptoms that you commonly encounter in PH, and it differs from patient to patient whether it is sudden in onset or if it is progressive. The diagnosis of PH is clinical as well as certain parameters, whether it can be laboratory or even certain tests that you need to do. So like I said, that there are these symptoms like breathlessness, fatigue, tiredness, syncope that can happen, but in the diagnosis of PH you need to do few tests, that is your ECG. There can be certain changes in the ECG that help in telling whether you have got certain changes because of pulmonary arterial hypertension. Then one of the most common tests that we do is a heart scan, that is echocardiography. And in this, what you may encounter is that sometimes if it is because of a hole in the heart, because of cyanotic heart disease, then your right heart pressures can be elevated, plus you can find the defect. At the same time, the patients can have right heart enlargement, and you can also calculate the pulmonary arterial pressures on the echo. There are certain other tests, like if you got an acute emergency like acute embolism, then you can do a CT scan that is normally done like a CTPA, pulmonary angiogram, to pick up if a arterial thrombus is occluding the pulmonary arteries. So these are the common tests that we normally do for the diagnosis, and then based on the staging and whether the patient has got elevated PA pressures, you need to address the various aspects of PH, and you can manage them accordingly. So friends, PH, though it is a rare disorder, but we should not get disheartened, because now there are such wonderful therapies that are available in the management of PH, and it improves your 6-minute walk test, your daily functional life, and even the symptomatic improvement is so good. My earnest advice would be that if you are having this disorder, do consult your cardiologist, meet them, because now there are wonderful newer drugs that improve your mortality, your morbidity, the daily quality of life, and you can have a stressful life. So there are these various aspects of PH that you need to attend. The management of PH differs from person to person. If the patient gets very breathless and there are some symptoms that what we call as right heart failure, then sometimes you have to restrict your water intake, but have a good nutrition, have good intakes of fruits and green leafy vegetables. You can also exercise and have a good quality of life. So whenever in trouble, please understand that it is a treatable condition, and thanks to newer technology, people are living longer and much better with a better quality of life. So I would like to add that PH, that is pulmonary arterial hypertension, is treatable. What I would like to say is that if you are having these symptoms like worsening heart failure, breathlessness when you walk, and you are told to have PH, don't get disheartened. Thanks to the modern technology, there are wonderful drugs and lifestyle changes that you can do to have a very good quality of life. So I would request you that if you are living with this disease, don't get disheartened. There are wonderful choices and drugs that are available. Do consult your cardiologist in case you have these symptoms, and they are the right people to guide you on how to manage and live with this disease.